from substance abuse, we had a recent interview with the Malakal Teaching Hospital admin, and they say they do not have a mortuary in the country, in the states. So, and they call on the National Ministry of Health to respond on that matter.
As you know, Malakal used to have got a mortuary.
Yeah, the only one that was there was destroyed during the war.
It was destroyed.
Currently, they say they are mixing patients, dead bodies, and patients that are coming in.
It's not true. Do you know why I say it's not true? Because from a health perspective, you know, we have got respect for the living and respect for the dead. There's no way that you will mix patients, like, you know, like, and dead bodies. It is not true. We have got a room that is actually like allocated for putting in, like, you know, dead bodies as they wait preparation to be buried. It is not a mortuary, but it is a room, because as you know very well, our resources are very limited. You know, even here in Juba, the two mortuaries that we have are actually, like, you know, like overwhelmed, because like the population is growing. The population is very huge, and the facilities and infrastructure are the same on that we have, like, you know, before independence. You know, so in Juba we are building a very big mortuary, you know, like on Yei Road, near Onmis. You know, like the POC one, like now the IDP camp here in Juba. We have got a very big mortuary that we are building. So like in all these 10 states, or let me call it like in all these major referral hospitals, we have got 4 or 5. We have got Juba Teaching Hospital, we have got Wow Teaching Hospital, we have got Malakal Teaching Hospital, we have got Kir Mayardit Maternal Hospital in Rumbek. We are trying our best to build, like, you know, like the best mortuaries that we have, with a proper supply of electricity, you know, like for fridges to put the bodies. Okay. So what they are saying that like the dead bodies and patients are being mixed is not true. You know, like they're not being mixed. We have got a room that has been given.
But it's true that they do not have a mortuary at the moment.
Of course, because it was destroyed.
Okay.
It was destroyed. Like even here in Juba Teaching Hospital, the mortuary that we have is overwhelmed. You know, it is overwhelmed because the reality is the population has exploded. Exactly. And the resources have remained the same. The infrastructure is the same. So we are working on it. You know, we are working on actually like rebuilding most of our infrastructures, like, you know, like in the country, like the health infrastructures. And that goes back to funding. When you have got more resources, you do more. And when we have got very, very limited resources, as we know, global economy was impacted. We have got recession that took place. We have got the global pandemic that happened, which is called coronavirus, we all know. Yeah. It is having impact in the West. It's having impact in Kenya, where you grew up. Impact is everywhere. It's not only particular to South Sudan. Okay. So we are doing the best that we can with the resources that we have. But it's also important, you know, to ask the information you are asking, to know the truth from the false, because nobody in their rightful mind will actually put patients and dead bodies together. It's not true. It's
having them in the same building, like, you know, there's already a separate place where the mortuary is in the same. Let's say we have the hospital, I will talk of Nairobi Hospital, they have a mortuary place and where patients are, but now that one, it's not separated, it's like having the same people.
It is separated.
Okay.
It is separated. We are using a different room from the amber, from the wards. The wards are separate, and this particular room that we gave for the dead bodies is actually separate. Okay. So whoever gave that information, they need to recheck.
Okay.
Yeah.